that time of year.
Yes, back to school time, of course, right? A lot of parents are looking forward to it. There are so many back to school issues to talk about with our New York City Health Commissioner of Health and Mental Hygiene, Dr. Ashwin Vasan is here with us this morning. Good to see you.
Thanks for having me.
Our first question we want to talk to you about is the migrant children that are here, many of them that don't have primary care. So the question is, as they enter school, what about all the vaccinations that they're required to have? Is there a concern for the city that not all of them will get vaccinated before school starts?
Well, look, I mean, the rules are the same. Every single student attending New York City public schools, as well as our private school system as well, under state rules, needs to be vaccinated against the same set of conditions: measles, mumps, rubella, tetanus, diphtheria, polio, etc. So the rules are the same. Now, of course, every student gets a grace period. We acknowledge parents have challenges, life circumstances. Everyone gets a few weeks. If you're in temporary housing, temporary shelter, you get maybe a little bit of a longer grace period. But our concern is really, how do we get those kids connected into a pediatrician, primary care, so that they can get all of their vaccinations taken care of? And that's what we're doing at the Navigation Center at the Roosevelt Hotel, is that we're starting that process. So
that's the vaccination plan for migrant children?
That's where we're starting, right? I mean, getting them connected into care is essential, right? Immunization care is a part of overall care, and so we want to make sure that's routinized.
And for those who are not vaccinated, right? If you're an asylum seeker and you have a child who, in that grace period, does not get vaccinated, is the city monitoring that to then say, well, unfortunately, you can't come to school then?
Well, that's how it goes, right? For any student, regardless of whether you're a migrant, a new New Yorker, or whether you're here and born here, if you don't present proof of vaccination, all of your required school vaccinations by the required time as set by your grace period or school, then yes, the DOE is certainly has the right to say, you can't come until you do.
Yeah, so you talk about those required vaccinations, but what about the vaccination for COVID-19? There's new variants now out. I don't want anybody to think that this is another Omicron, right? I mean, this is clearly not that. Some are calling it a scariant more than a variant.
Well, I think it's just, we're tuned up, right? We've been through 3 years of this. If you really look at the numbers, this bump that we've experienced over the last several weeks is much less than we've experienced in previous summers, where we always expect to see some increase. So that's good news. Number two is that even though hospitalizations have increased, the majority of those are still people who are getting hospitalized for something other than COVID and then found to test positive, right? So that's more than 50%. And then lastly, we're not seeing any increase in severity of illness. And the people who are getting severely ill are above 75, unvaccinated or undervaccinated, and have an underlying chronic health condition, which tells us, go get boosted, get vaccinated when we're getting a new booster in the coming weeks before the end of the month, which will be updated for this season, and make it a part of your routine annual physical.
Yeah, with the flu shot too, right?
Correct. I'll be doing that. I did it last year. I got both at the same time.
Right.
Happy to come here and do yours.
I think you're going to, right?
I hope so.
Very good.
I know you want me to show my arm. So here's the thing.
He's going to be working out the next few weeks.
Yeah, gotta get some arm muscles going. There's been a lot of conflicting over information. If you look on social media, right, people are saying, especially today, you look at somebody like the First Lady who has COVID-19 now after being vaccinated and boosted, right? And talk about some of the concerns from people on social media who are like, well, look what happens even if you do get boosted, you get it. Kind of help us understand.
Well, look, we've always said that vaccines prevent against severe illness and death, right? It reduces your risk. It's 2 days on the couch versus the potential of 2 days in the hospital or in the ICU. So that's first and foremost. Dr. Biden is convalescing at home and will be better in a couple of days. So that's good news, even though she got it. Look, I think we have to talk about these vaccines in the way that they're most effective, which is to reduce our individual risk of a bad outcome, and which means we should all be getting updated on our boosters, but especially people who are above 75, people who have an underlying chronic health condition, people who've got a history of bad episodes of COVID-19. These are folks that we put in this higher risk category. It's essential that those folks in particular get this booster in the coming weeks when it becomes available, and make it a part of your annual physical as we enter into the fall and winter viral season.
I mean, and kids too, students, you're going to be in those closed classrooms again. It's very critical for them as well.
Well, look, we want everyone to get the booster. We want everyone to be up to date. We want our kids included in that. Right now, COVID vaccines are not included as a part of mandated school vaccines, but we're recommending that parents talk to their pediatrician, get your child vaccinated. It's proven to work over the several years we've dealt with this, and so how do we make that a part of our routine annual checkups and back to school physicals? That's how we do this.
Well, talking about back to school, right? Back to school this year is happening in the middle of a heat wave, really, with 90-degree temperatures on the first day back to school. Some schools may not be air conditioned, right? So what's the advice for kiddos who are heading back to school and for teachers?
Yeah, so look, I mean, I think ventilation is key, air circulation is key, hydration is key. So even if you don't feel thirsty, staying up to date on your fluids, drinking more than you might anticipate you need, really watching out for signs and symptoms of dehydration, clammy skin, disorientation, headache, fatigue, and avoiding prolonged and strenuous activities outdoors. If you're a New Yorker who needs to get cool, call 311, find one of our cooling centers. And our schools are obviously taking a bunch of precautions to make sure that that first day of school is a safe day of school. And I know that the heat wave, we're hoping that the heat wave will break after Thursday.
And maybe teachers got to be a little bit careful of not taking in too much caffeine to stay up with
Caffeine's, it's a really important point, right? I mean, I think moderating our caffeine intake along with water, making sure that we're taking a little bit more water in than maybe dehydrating liquids like tea or caffeine is really important during a heat wave.
Gosh, okay, don't look at my drinks over there.
Mine either.
It's just like this much caffeine, and I got to do equal parts here. Dr. Vasan, good to see you as always.
Thanks for having me.